audio.
Boy, people are flooding in there.
Bureau phones ring? Yeah, bureau phones, they have a tendency to ring in here.
Is this gonna be on time, Brian?
I don't know. We'll try.
Probably still back there mixing up the whitewash. Thank you.
Have you watched this movie, Skip?
Which movie is that?
The one you got over here?
Miss Congeniality 2?
No.
I started it.
Don't even bother.
Yeah, well, that was one of the ones the wife bought.
Miss Congeniality 2.
Yeah, Charlie, I'm secure enough in my man.
Those thousands. Sound like those thousands of emails I get, spam emails I get every day.
I'm sorry, I didn't bring the Sands of Iwo Jima.
Miss Congeniality.
It's only a flesh.
Miss Congeniality 2, produced and directed by Philip
Thanks, Terry.
You're welcome, Skip.
My brother over there.
Well, Lisa wasn't the first.
That was good.
That was a good
Well,
movie.
they actually, I was just giving Colonel Skinner a hard time about that. This was good.
That's more than I can say for this movie.
Poor Josh has got.
Yeah, actually, Dennis was waiting with bated breath for me to bring it back today so he could watch the second half of it.
Hey there.
Too hopeful, I think we actually.
Some of the interns were never out
Right off the shore.
Charlie, have you heard of
Brian was out here a second ago and he said he didn't know you. Who knows? Lincoln was. Where is he? I thought he was going to do it. He's out.
He's out on 16.
I don't even know why I'm playing it online.
3 iron.
It's raining.
I don't know. I don't see a light ahead.
The weather, like,
Remnants of Cindy.
Lincoln will be here at 9 o'clock.
bullpen, right?
British steel.
Just played them in the restroom.
Good, Charlie.
Writing that up. Yeah.
Encouragement. At least he comes right on it, like having hung around. Yoga is like lucky stretches. Oh my gosh. I know. I'm really working out.
I know, why not?
How is this different from when he said?
This was supposed to, Kylie was supposed to be specific incidents.
Well, he was supposed to say how they find these people in the race.
What's that beast you got on that camera? 300? 280? Why don't you leave that over by my desk?
God, you sound bored.
No. All boys jumped into the RC.
Paul Boyce, a CD man.
Oh, you do. Since your first cut shot, you're not
They call this an assessment, not a study.
Then he came back to the press room about an hour.
Maybe he did, I don't know.
He said there he was.
We'll drop it when we're in here.
Is there anybody back there interested?
Cubs are just, I'm scared, they have something to think their way out of it. They lost 7-0 today. Already, yeah. they hit 50 completion.
He went on the British Embassy.
He went to the British Embassy.
Well, I was there, that was right.
What's he doing there?
She signed it. Expressing his
Condi went over there.
solidarity.
We had more public officials hearing about this than they had the Brits have.
I saw stat on ESPN the other day about fewest home run.
America quickly moved to Americanize the tragedy.
Right, exactly.
To remind the world how important the war in Iraq was. Stopping the terrorist bombings in London. I'd rather fight them in London than over here.
Right.
He's on MS, Terrence.
Yeah. Not this year.
Oh, there you go. Welcome to
You know, let me tell you something.
Yes.
When I started 40 years ago, I grew up in the Music Corps, and as a rookie, you know, you start out, they only just put down so many years. I know it's pretty straightforward. My first story, and I don't know if this is funny, because I could not, I couldn't do it, I could not. I have a nice story about 70 or 80. He died of sepsis after a war. He's living in the middle of and it was just, of course, it's not on the paper, but I mean, I sat there, I was a reporter. The newspaper was supposed to be there, struggling to write that story. Well, I mean, you know, there's somebody who's gonna have
No way. How come they
that
can
was
make
never
the
made.
paper?
I don't know. Probably didn't make it in the paper.
Right. Seems like you just wrote a pretty straightforward read right there.
I read a feature on a solar powered car race.
Oh, no. You're now you're really going help me serve for your first story before.
I think it was about a solar powered car race
Yeah.
at a college. Stepping into it. F-16 bombing a Iraqi missile service unit.
Love that giant altitude. When I went to Iraq in 2003, initially in altitude, and I was like, here I am. I've been writing about this place for years.
See any burned out surface air missile sites?
No, actually, what I did see were some brand new French surface-to-air missiles.
Oh, yeah?
They were like, these are from Raphael, our friends, the French. But yeah, I did actually see a lot of Heads up.
You're coming up. Sure.
Okay. Probably deadlines.
What are you people doing back there?
Well, good afternoon, and thank you all for being here this afternoon and for your interest in this topic. Before we get started, I just want to mention that Secretary Rumsfeld this afternoon, in fact, just a few minutes ago, went over to the British Embassy to personally express his condolences in the attacks that took place in Great Britain today. For those of you who may not have seen his statement, we did put out a statement a little while ago. If you don't have it, we can certainly get it for you. Today we are here and joined by Dr. Steve Jones, who is the Principal Undersecretary of Defense for Health Affairs. He is Dr. Winkenwarter's Principal Deputy, who unfortunately could not join us today. And he is joined by Lieutenant General Kevin Kiley, who is the United States Army Surgeon General. They're here today to talk to you about the assessment that they have conducted with respect to detainee medical operations. Mr. Jones will start us off today, followed by a review of the assessment by General Kiley, and then we'll take a few questions and wrap this up.
Good afternoon, and I've only been here since November, so I haven't had a chance to meet many of you, but hopefully I will as time goes on. And I would like to also second express Brian's, Dr. Winkenwarter has a personal interest in this issue, and he wished he could have been here with you today, but unfortunately, unavoidably couldn't. So I'm pleased and honored to be here in his stead. This afternoon, we want to add to the factual knowledge in the public domain concerning activities of military healthcare professionals with detainees held in this global war on terrorism. The Defense Department has directed and sponsored numerous evaluations, investigations, and assessments to identify details of detention at facilities and prisons in Afghanistan, Iraq, Guantanamo Bay, Cuba, and as you know, we learned from those reports that some inappropriate behavior took place, but that those instances did not represent the overwhelming majority of our military personnel engaged in detainee operations. With each report that offered new information, this department took actions to correct policy and practices, as well as to hold accountable those who acted inappropriately. Inappropriate behavior, unlawful activities, inhumane treatment are not tolerated. However, recognizing that instances have occurred is necessary in order to improve and take actions essential to prevent future reoccurrences. This process of identification, accountability, policy and practice reinforcement, and improvement is ongoing. Our approach in pursuing this improvement is both objective and ethical. In all matters affecting the physical and mental health of detainees, our military healthcare personnel have a duty to perform, encourage, and support actions to uphold the humane treatment of detainees. In treating these individuals, medics are guided by professional judgment and standards similar to those that they would apply to the treatment of U.S. Armed Forces personnel. This includes a duty to protect both physical and mental health. Our military medical personnel provide outstanding medical care for detainees who suffer disease or injury. From the healthcare perspective, we have reinforced our policies, practices, and medical support to detainee operations. Over a year ago, we positioned a combat support hospital in proximity to Abu Ghraib to better support the healthcare needs of detainees. We revised our policy regarding the notification and conduct of forensic examinations and autopsies of detainees, ensuring that both investigative agencies and the Armed Forces Medical Examiner received notice of detainee deaths for further evaluation. We reemphasized our policies regarding detainee records management and confidentiality. The Army updated and reissued their handbook of emergency war surgery to address medical management of prisoners and detainees. Last month, the Department issued a memorandum reaffirming policies regarding the protection and treatment of detainees in U.S. custody. Today, you will learn details of a comprehensive assessment conducted by the Army Medical Department to gain even more factual information about detainee medical operations. I wish to commend General Kiley for commissioning this assessment, as well as those team members who conducted the numerous interviews and compiled the resulting information. The men and women of our military healthcare system with whom I come in contact with daily are of the highest professional caliber. I firmly believe they're acting appropriately in their duties to treat all detainees humanely. With that, let me introduce to you Surgeon General of the Army, Lieutenant General Kevin Kiley. Kevin.
Thank you, Steve. Good afternoon, everyone. We did learn a lot from our military medical personnel who have been and are currently deployed into support of detainee operations in Afghanistan, Cuba, and Iraq. And Dr. Jones is correct in his characterization of our military healthcare professionals. They are taking the correct actions and honorably performing their duties to this country. This 5-month assessment confirms that. As the Army Surgeon General, I directed Major General Martinez Lopez to conduct his comprehensive assessment of detainee medical operations in Cuba, Iraq, and Afghanistan. General Martinez Lopez and his team of 6 began their assessment in November of 2004 and completed their efforts in April of 2005. This was an assessment of policies, procedures, and doctrine, not an investigation. The team's mission focus was on obtaining information in 4 specific areas: detainee medical policies and procedures, detainee medical records management, incidents and reporting of detainee abuse, training of medical personnel in these areas. The team reviewed all previous detainee assessment and investigative reports. Team members visited 5 countries and 22 states, gathering assessment information from healthcare professionals in over 180 military medical units. They interviewed more than 1,000 medical personnel and surveyed 178 officer basic students, enlisted medics, and trainers at deploying installations. These interviews were largely with active duty or reserve component medical personnel. However, some Air Force and Navy medical personnel were interviewed. The assessment findings include the following. The majority of medical personnel interviewed did not observe any abuse. And with few exceptions, those medical personnel who did observe suspected abuse reported it. The assessment team referred unreported suspected cases of abuse to CID or to the chain of command. We found no evidence of systemic problems in detainee medical care. We also found that although initial policies for detainee medical support were inadequate, medical care received by detainees was good. Initial training was limited, and generation of detainee medical records was inconsistent. As the theater matured, these policies and training programs were developed, published, and fielded. Military medical training now includes detainee medical operations and is incorporated into our medical officer and enlisted training and medical pre-command courses. And so in summary, the assessment results demonstrate that the nation can be proud of our military medical professionals. We have a dedicated team of them working every day to provide quality health care for each patient they treat, whether a U.S. service member, coalition troop, or detainee. The assessment clearly demonstrates that military medical professionals reported suspected abuse in the overwhelming majority of cases. Allegations of possible abuse were routinely forwarded to the CID or to the chain of command, or corrections were made on the spot. Detailed medical care is now standardized across the OIF, OEF, and Guantanamo Bay. Thank you all very much, and I'll take your questions now. Charlie?
General, you say that there's no evidence of systemic abuse or collusion by the military in any abuse. But you promised to give us specific examples of problems that you've had. Could you give them to us? Cases in which there was collusion or abuse.
Well, I'm not aware in the assessments report of any cases of collusion between medical personnel and any potential episodes of abuse. There were some cases where medical personnel were observed in their care for detainees that was not in concert with our standards for health care, specifically the possibility of dropping a stretcher a little too roughly, or withholding pain medication until the very last second, as examples of the level of perceived abuse. On-the-spot corrections were made to those within the medical facilities and the chain of command.
Well, the Lancet, the British Medical Journal, reported last year that there were instances that said, where medical personnel intentionally did not report abuse, and in one case, apparently revived a prisoner who had been beaten so that he could be beaten again. You had no, you
I
found
have no evidence in that assessment of any of those episodes. And our assessment team looked at all of the news reports and medical reports that have been published as part of our directive, and attempted to reconcile those efforts. And I'm not aware of any. I'm not aware of any reports of medical personnel reviving people for further abuse.
Could you tell us how many allegations or how many cases you had referred to the CID?
The number of individuals interviewed who answered a question, did you observe anything that you were concerned may have been abused, was 32 out of over 1,000 interviews. And of those 32, approximately 26 were reported to either the CID or the chain of command.
By that person or by your?
By that person in those cases, because the interview process was a questionnaire. The first question asked, did you see anything that concerned you that may have been abused? The second question that followed that was, what did you do? Did you report that? And 26 of the 32 said they did.
And what about the remaining 6?
The remaining, in general, were individuals who didn't report it to the CID because they made on-the-spot corrections.
Any punishment in the cases?
I don't know the answer to that. I don't have what kind of punishment was done other than verbal counseling, direction not to do that kind of thing again.
And do you have a sense of what the results were from those 26 cases that were reported to the chain of command?
No, the CID has got our whole report. The CID command, they are reviewing those cases again. They're in the process of validating where they can with their own information sources, cases that they see may have also been reported to them. I don't have any more specific numbers as to exactly what happened to every single one of those cases.
General, did your report look at the issue of whether or not military doctors, specifically psychologists or psychiatrists, aided interrogators, preparing them for interrogations to get more information, the so-called biscuit teams?
Yes. We interviewed 11 psychologists and psychiatrists who were serving in roles of what we now are terming the biscuit teams, and the sense of their interviews was that they clearly understood that they were not healthcare providers, that they were consultants to the interrogators, and every single one of them, to one extent or another, voiced a sense of responsibility to ensure the welfare of detainees during the interrogation process.
Well, did you find any evidence to support or deny the allegations in the New England Journal that caregivers, not biscuit team members, but caregivers, were sharing that type of either physical or psychological information in order to give interrogators a hint as to how they might get more out of people?
Yeah, we did not find any indication of that in our assessment. The interrogators and the biscuit team members have a firewall, if we can use that term, between them and medical records. And in our assessments with the biscuit team members, we found no evidence that there was a passing of clinical information that would be used in a detrimental way to torture.
And did you find any evidence one way or the other on whether healthcare personnel, whether on biscuit teams or caregivers or others, were involved in supporting any sort of aggressive or abusive interrogation techniques, which is also alleged?
Yeah, there was nothing in the assessment statements that would lead me to think that. I did not see that in the statements.
General, what prompted this assessment? Was it?
There's several things. One was our concern that there was a growing sense that medical personnel may or may not have been involved in detainee abuse and torture. We reviewed other published reports and found very little reference to medical operations or medical issues, and we felt I felt frankly obligated to demonstrate what I intuitively knew, which was that our doctors and our nurses and our medics were doing the right thing, taking care of detainees as well as they could under the circumstances where they would find themselves, and felt like a team that was empowered to do an assessment by some investigation, but at least give us a sense of whether we had been doing the right thing or not, and that is our conclusion.
Would you explain the ethical or legal firewall between the biscuit teams and the medical records? Why does that exist?
Well, we have a DoD policy on that now that does address privacy in healthcare records for detainees. Additionally, I think the feeling was just to be sure that there was no perception that biscuit members were either also healthcare providers to the detainees, which would put a biscuit member into a real bind that they were a healthcare provider to a detainee and at the same time consulting with interrogators. So one was one of perception, and then just administratively to keep things clean.
Did biscuit members ever have access to the medical records prior to that policy being put into place?
As I understand it, early on in operations in Guantanamo, and I can't tell you for how long, the original members had access to the medical records.
The six who didn't report the abuse, where did it happen? In Afghanistan, Cuba, or Iraq?
I'm sorry, could you?
The six who didn't report
Right.
the abuse, where did it happen? In Iraq, Afghanistan?
I
or
believe
Cuba?
it happened in medical units in Iraq, which was again was the answer to the question was we didn't report it because we didn't feel we needed to report it. We could do an on-the-spot correction and fix the problem.
General, excuse me, are you saying, just to clarify what you said before, that there was no evidence in your assessment that any of these physicians, doctors, psychologists, or psychiatrists, biscuit team members, aided interrogators in any way in refining coercive interrogations by giving them information or advice on how to increase the stress levels?
I didn't say that. I didn't say that. We did not get into a level of detail in the assessment about the specific advice and recommendations that biscuit members gave to interrogators. Specifically, did you do these things or not do those things? What we asked them was what did they perceive their roles and missions to be, and in general terms they answered with advice and assistance to the interrogators, and then a secondary mission to ensure the well-being of the detainees.
But you didn't get into details on that first part, you said that. Whatever that advice was.
Right, that's correct. To my knowledge, as I stand here, no.
You mentioned sort of incidents that involved medical personnel, like dropping a stretcher from too great a height or withholding pain medication. Is there a number?
Delaying, if I could correct you.
Delaying.
It was a delaying versus withholding.
Okay.
Right up to the fourth hour of every 4-hour medication.
Is there how many occurrences of that did you find?
Well, of that nature, quantifying that in a range from something simple like that to a healthcare provider who is hit or struck by a detainee and slaps back or hits back. I don't have a specific number. It was a certain percentage. I mean, the whole group, the whole 1,000, only had 32 positive incidents, and so I couldn't give you an estimate. I haven't tallied it up that way. It can't be more than 10 or 12 in that group.
Okay, so the 32 you're talking about, because you said that was observing abuse, and this
Right.
is where this is actual medical personnel who could have committed an act of abuse.
That's not 32 cases of medical personnel observing medical personnel. That's 32 cases of medical personnel saying, I saw something that I thought may have been abusive. And it included detainees who came in abused. It included detainees being held on tarmacs out in the sun. It included observation of senior leaders hollering at detainees. So it was a whole host. This was not 32 cases of medical personnel observing medical personnel. I don't want you to get that.
A subset of that is
A small subset of that were a couple of cases inside of our facilities.
So these are among the 32, what you're
Yes,
talking
sir.
about, possible slapping back?
Oh, slapping.
But these are among the 32,
Yes, sir.
not in addition.
Yes, sir.
One of the things the New England Journal of Medicine brought up is the role that the biscuit teams played, and I think that there's a sense, at least from them, that there's something creepy about a physician or a doctor using their medical knowledge that they gained in med school and then took a Hippocratic oath to increase stress or to do anything other than heal. Can you talk about that as a physician?
I know that's an issue. My sense is that interrogations that are safe, legal, and ethical within the confines of our operations, that medical advice and recommendations that are also safe, legal, and ethical are probably appropriate. I would suggest there are those that probably don't agree with that. I know the American Psychological Association has recently issued a policy statement recognizing the requirements for psychologists to have an ethical view of their duties, but it doesn't prohibit them from assisting in interrogations. And in terms of the ethics of a physician assisting in interrogation, I'm not sure I have an answer to that specifically. I mean, in a safe, ethical, and legal environment, my sense is that that's appropriate.
General, do you feel like you have a full picture of this issue, considering that your assessment only interviewed and surveyed your own medical personnel, or did you also speak to detainees, their representatives, Red Cross, or other independent groups?
I do think it's an accurate assessment for a couple of reasons. One, the 1,000 personnel that we interviewed were focused interviews in the sense that we looked to medical units that were clearly identified as being part of detainee healthcare operations. So we went to the hospitals associated with Abu Ghraib and other locations, validated that those facilities were in fact taking care of detainees. So we were asking the right people. Doesn't do any good to ask medics in a maneuver combat unit that aren't seeing detainees what they know about detainee health care. So we went right to the source. We did not talk to detainees. One of the other subgroups of questions and answers was in our patients were, did detainees claim that they were abused? And there were those that did. And almost to a person, those allegations or claims by detainees were reported to the chain of command or CID. So indirectly, we took feedback from detainees, or individuals we interviewed had taken feedback from detainees.
Speak to the Red Cross? Or
We did not. We did not talk to any of those other organizations.
Time for about one more.
General, you mentioned you interviewed 1,000 people for this. Do you have any estimate of how many doctors there were or have been in the field and have worked with detainees in that capacity?
I don't have an answer for the number of doctors. We interviewed about 192 physicians and about 211 nurses, 6 dentists, physician's assistants, and then about 400 plus enlisted personnel across the range. The broad number we have used across all theaters of operations since the global war operations began is about 20,000, but those 20,000 medical personnel were not all involved in detainee operations. Unfortunately, I do not have a number to tell you of the 1,000 we saw was that a third, half, or 3/4 of the total number of medical personnel. I just don't have that number. But we know we focused on medical groups, medical units, and non-medical units that were involved in detainee operations and detainee care.
Sorry, let's make your
Yeah, just put this in context. Somebody just turning on TV now watching this, they say another Abu Ghraib report or another Abu Ghraib investigation. Where do you fit in terms of the Taguba report, the Fay report, the Schlesinger report, all the things that have been done in the last year? Just kind of summarize where you fit.
I would say to you that my initial blush when I saw the responses of the assessment actually reinforced what we saw when we looked at Taguba and the Faye Jones-Kearns report, which is that there was a paucity of issues associated with medical personnel in those other reports, and our own assessment says the same thing. We just did not see. Even if you were to believe the canary in the cave theory, that there's somebody out there that saw it all, and if we just got to him, he would tell us everything. We just did not find that. I mean, the soldiers, when they thought they saw something, they reported it, and they told us in our interviews that they reported it. And frankly, they were grateful somebody came and asked them. So from a medical perspective, I have a sense that this kind of brings some closure to some of the issues that have been out in the press about, this great silence in the medical community. We haven't heard anything from the medical community about this. And we've been working on this for a long time and very aggressively attempting to ferret this thing out. And I think we've got an answer that says our doctors and nurses and medics, did the right thing.
Thank you very much.
So, thank you.